This is One-on-One. Dr. Yukiko Kimura is Section Chief of Pediatric Rheumatology at Joseph Sanzari Children's Hospital at Hackensack University Medical Center. Good to see you, Doctor.
Nice to see you too, Steve.
This is an area we have not touched on. Juvenile pediatric rheumatic diseases. There are so many of them. But I keep thinking, are we talking about arthritis? Or is arthritis a piece of this larger equation?
Well, both things, actually. You know, pediatric rheumatic diseases are a big sort of conglomerate of different diseases.
By the way, what does rheumatic mean?
Usually people think of it as affecting the joint or causing inflammation in some way. And arthritis is a big piece of it, usually. You know, people are surprised when they hear about what I do because they think, arthritis, kids? I mean, how do those two things go together?
Give that up for me.
But actually, arthritis is one of the most common chronic diseases in kids. People don't realize that. Even doctors don't know that, actually. And so we need to really get the word out there that it's really a common problem. It affects probably at least 1 in 1,000 kids out there in the United States. And we have so many new and exciting and effective treatments now that really affect the outcome, especially if you can treat it early. So we need to find them early.
Talk about some of the treatments that cause us to be hopeful.
Well, I mean, 10 years ago even, or 15 years ago, we used to have kids who commonly were quite disabled, had deformities in their joints and their bones, had poor growth, etc. And now we hardly ever see that anymore because these treatments, and there are so many out there now, these new biologic treatments that are so effective that you can hardly tell that there's anything wrong with them, these kids.
Doctor, is there any difference between the way you would treat a child? I know every case is case by case, right? Is there any difference between the way you would treat a child with arthritis as opposed to an adult?
In some respects, yes, but a lot of the medications are the same.
Different dosage?
Different dosages, and it really depends on the type of arthritis the child has, because in contrast to the types of arthritis that we see commonly in adults, the ones that happen in children can be very different and have different, ways of manifesting themselves, and may respond differently to medications. So you have to really be sensitive and knowledgeable about that and know how best to treat them. And know how, really about how you can use these medications safely, I guess.
Let me ask you about one of them. JIA.
Right.
Juvenile Idiopathic Arthritis.
Right.
What is that, and why does the literature talk about it so much?
Well, it actually is a relatively new terminology that's come into use about in the last 10 years. People used to call arthritis in kids JRA, or juvenile rheumatoid arthritis, but as I just said, rheumatoid arthritis per se is pretty rare in kids, and so there was an international kind of symposium of experts that sort of tried to agree on some terminology, common terminology, and that's where it came from.
It's more about language than anything else?
It's language and how to identify and classify these kids, because there are about 6 or 7 or even possibly more different types of arthritis that
For
are
parents, I'm sorry for interrupting, Doctor.
That's
for parents who are watching right now, what symptoms should they be looking for in children?
Well, pain, joint pain, pain in their legs, their arms, swelling of the joints, are the most common things, or limping, especially if kids can't really express how they feel or what hurts. They may see it in changes in their behavior, or a kid who previously was able to walk, who isn't able to walk as well as they could, or goes back to crawling, stiffness in the morning, or irritability, or inability to stand up, in the crib in the morning. Those kinds of things are probably important to look for.
Well, let me ask you, parents take the child into the pediatrician. Are most pediatricians trained to pick it up?
Well, pediatricians are pretty good. I mean, they pay attention when kids come in complaining of pain.
Are they looking for this?
That's the problem. I think that because it's not well known how common it
Yeah,
is.
because, excuse me, you started this interview by saying many physicians don't even know
Right.
about it. So therefore, I'm thinking, okay,
Well, they know about it in theory, but they don't know how common it is. So immediately when a kid comes in complaining of pain, they think something's broken, there's a sprain, there's something else going on, and so
arthritis is not on the radar.
Exactly.
And it should be.
It should be, absolutely.
Does early detection and diagnosis matter much in terms of the outcome?
Absolutely.
Go ahead.
Absolutely. Like I said earlier, there's so many new and very effective treatments out there. So the earlier we can treat these kids, the better the outcome. Unfortunately, I still see kids sometimes who have suffered for months, sometimes years. I mean, recently I saw a teenager who's 18 who's probably had really terrible arthritis since she was 8 years old.
And not diagnosed early on.
No.
Could have made a difference.
Absolutely.
You can't cure it, I want to be clear.
No, you can't cure it, unfortunately. But some kids do go into remission, meaning that it goes away.
Early detection matters.
Absolutely.
Getting
Absolutely.
the right doctor, the right treatment matters.
It's critical.
Okay.
Critical.
Doctor, you said people can call you
Yuki.
Dr. Yukiko Kimura. I want to thank you for joining us. This is an important area, and people should consider this as a possibility and not put it off the table.
Absolutely.
Thank you so much, Doctor. We appreciate it.
Thank
We learned
you.
a lot. It was very helpful.
Thank you.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating 25 years of broadcast excellence. Funding for this edition of One-on-One with Steve Adubato has been provided by the New Jersey Education Association, working for great public schools for every child, Wells Fargo, the Adler Aphasia Center, PSE&G, committed to improving New Jersey's economy and strengthening its communities, New Jersey Manufacturers Insurance Group, auto insurance, homeowners insurance, and banking under the principle of stewardship. The law firm of Gibbons P.C. Horizon Blue Cross Blue Shield of New Jersey, making healthcare work. And by Bloomfield College, offering small classes and big opportunities since 1868. Promotional support provided by the Star Ledger and NJ.com, Everything Jersey, and by NJ Biz, All Business, All New Jersey. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area. One-on-One with Steve Adubato has been produced in partnership with St. Joseph's Healthcare System.